I'm really happy to introduce Dr. William Miller as our guest here. He and I are going to have a conversation about motivational interviewing and coaching. Welcome, Bill. Good to see you.
Thank you, Michael. Good to see you again.
Yeah, Bill and I were very fortunate to meet at the annual Health and Wellbeing Coaching Conference in San Diego this last June. And we're able to have a little bit of opportunity to get acquainted with each other. And at that conference, Bill received the second Lifetime Achievement Award for his incredible work and contributions to the whole field. So before we get underway and get chatty here, I'm going to go ahead and just read Bill's introduction that's on his website. And he puts it in first person, which I really appreciate. He says, after receiving my PhD in clinical psychology at the University of Oregon, I have been at the University of New Mexico since 1976, where I retired as Emeritus Distinguished Professor of Psychology and Psychiatry in 2006. Understanding addiction and its treatment has been a wonderful medium for pursuing my fundamental interest in the psychology of change. It has also been a fertile field for exploring the historic interface between spirituality and psychology. Now, you might think he's just been taking it easy there in northern New Mexico and learning how to be a horse whisperer and other things that he told me about, which was pretty cool to hear. But he's been busy. As you probably know, in 2023, a fourth edition of Motivational Interviewing, Helping People Change and Grow, came out with lots of rewriting and a whole new edition for us to really learn a great deal about and from. So, Bill, let's just go ahead and get into a conversation here.
Great. Thank you.
Yeah. Well, it's interesting to me how motivational interviewing and coaching, life coaching in general, and now health and wellness coaching really have the same fundamental roots. I think I shared with you, and I noted it in my latest book, that this image just kind of came to me one day, that it seems like there was a street and these people were walking down two different sides of the same street. One group is over here walking down the street, developing motivational interviewing and all of that. The other side of the street, you've got Laura Whitworth and Karen Kimsey-House and all kinds of people developing the whole coaching field. And they didn't notice each other across the street. And I think the name of that street was probably Carl Rogers Avenue.
Yes, indeed. Yeah. We owe very much to Rogers and his work back in the 40s and 50s. And fundamentally, what we do is a person-centered approach. Yeah.
Yeah, it really is. So many things have grown out of that. Appreciative inquiry and nonviolent communication and all kinds of things. And it really created a foundation that was really firmly built. When I came across your wonderful little book, which I really appreciate. You might not be as well known for this one, but I love it. It's Listening Well, The Art of Empathic Understanding. Wonderful little book that I'd recommend to everybody.
Yeah, I wanted to write down what I've been doing for about 50 years in trying to teach this skill of accurate empathy that Rogers described long ago. And over the years, developed a whole series of exercises that seem to work pretty well and build on each other. So each one is a little step in the right direction.
Exactly. Yeah, and what really struck me, right in the first preface there, you're talking about defining accurate empathy as, you say, it's something that you do, quote, ability to perceive and communicate accurately and with sensitivity the feelings of the person and the meaning of those feelings. And then the footnote from that was from Karkoff and Truax.
Yes. Yeah.
And their work on psychotherapy and counseling and so forth. And Karkoff, Truax, and Berenson were like foundational people that I was learning from, when I was in my doctoral work. And again, some real um, similar background and similar influences, I think.
Some people miss that Carl Rogers was saying, psychotherapy, counseling can be a science. You can measure outcomes.
Hmm.
You can listen to sessions, and when Rogers was starting his work, it was audio recording was relatively new, but he was
Hmm.
literally listening to sessions with a group and trying to figure out what is it that's happening here that
Yeah,
seems to be helpful, and can we measure that too? And
right.
so Truex and Karkoff's volume is a classic in how to measure those three attributes that Rogers talked about, and there are more than three now.
Yeah.
But we can measure what counselors do and relate it to how well clients do.
Yeah, his facilitative conditions of counseling and therapy. I pretty much hijacked him, and I call him, yeah, as well, the facilitative conditions of coaching.
Sure. Yeah.
And because to me, that's really what coaching presence is about.
Mhm. And also in teaching and in medicine and in so many fields,
Yeah.
that way of being with the people that you're trying to be helpful to makes a big difference. We focus in psychology a lot on techniques,
Mhm.
but who you are and how you're doing what you're doing is also at least as important.
That's exactly what I was hoping you'd be saying here, and I
Yeah.
and I knew it would be. Um, the how to be part is gigantic. I think to me, it's if you don't have that, I don't think your techniques, even if you know them really well, are going to be as effective or helpful. They aren't going to be received the same way by people, right?
Well, Steve Rolnick and I discovered that early in our training. We were trying to teach motivational interviewing back in the early 90s, and we were watching people do what we told them to do, and we were
Hmm.
horrified. They, they were using the words, but the music was all wrong. And
uh,
I said, that's not their fault. We left out something really important, which is the mindset or the heart set or the spirit with which you practice it. And so then we began writing about the underlying spirit of
mhm,
motivational interviewing. Rogers called them the attitudes with which
right.
you work with people, and it matters.
Exactly. Yeah, that whole spirit of MI, I think that's what people have to really understand before you get into, all the techniques or all the acronyms that you have for different, ways to proceed. But, I really believe that these fundamental ways of being, I loved how you said it, mindset and heart set.
Mhm.
Because one of the things that, and I'm not trying to just butter your toast here, but one of the things that really struck me when I met you and we got to spend some time together, have dinner together and everything, was you are the embodiment of this stuff. I mean, you live it, breathe it all the time. It isn't just, okay, I'm going to work with a person now. I'm going to put on my MI cap and, do this well. This is who you are.
But I wasn't born that way either. I mean, it's a lot of practice over time. But I do have the experience that I'm not a different person
Right.
when I'm teaching or when I'm doing therapy or when I'm talking to friends. I mean, so
No,
now I have the same sense of being with other people through all of those things.
exactly. And that brings up the word congruence.
Yes. Yeah.
Uh, Rogers talked a lot about congruence. And without that, when we don't have that, that connection that's, really sympathetic to who we are as well as what we're doing, um, something's missing.
It's a hard one to measure. I,
Yeah.
I did a few interviews for the change companies, and my assignment for one of them was be genuine.
Mhm.
No,
Yeah, right,
yeah, that's like say something funny. You're very self-conscious
right.
all of a sudden. It is measurable. You
Yeah.
can model it. Truex and Karkoff wrote some about how to teach it, but
Hmm.
it is an important thing to be yourself, to be a
Yeah.
real person present in the coaching.
Right. And, I think most people that are attracted to do this kind of work, uh, whether it's MI coaching or using the two together, which is, all part of it. I think most folks that are attracted to this are more that way naturally. I think folks that struggle with that kind of thing or just isn't their personality, they kind of find other routes to make a living and, be of service. Yeah.
Well, that's interested me. What is it that attracts people to this way of working?
Mm.
Because I've used the word recognize, that people seem to recognize it. I knew this, or a part of me knew this, and this is not brand new or strange for me.
Mhm.
But you're helping me learn better how to do it and what it is. Yeah.
Yeah. Yeah. And I think what starts to happen is as people practice coaching, or delivering MI or whatever, however you want to say it, and they get more comfortable with it, I think they discover that just what you're saying. Well, this is who I am. This feels right. This is natural. I don't have to work so hard at coming up with the right question, like there's a right question all the time. Um, I can just interact and be with this person following these guidelines, knowing what I'm doing, having a methodology, but my way of being is natural.
Richard believed that. I mean, he believed that at our core, we are positive, loving beings. That's our natural state.
Hmm.
It can get very messed up,
Hmm.
but if you give the right conditions, people will naturally move in that direction.
Yeah. Yeah. Rogers and Maslow, of course, had all kinds of overlap with what they were saying along that line, that human nature type of view, that it is about actualizing our potential. It is about this more positive, loving, uh, basic nature. Now, things get in the way, like you're saying, for
Oh,
sure.
yes. Hmm.
And that's where, therapists and everyone is there to help. And people find many ways to grow and discover who they truly are once again.
When I began talking to mainstream Rogerian folks, I was a little worried that the directional aspect of motivational interviewing might run into some conflict, because at least in the early days, Rogers described his work as non-directive, although he let go of that term.
Yeah,
But it was a perfectly natural thing. They said, well, of course, if a person is caught up in addiction and that's getting in the way of their growth, of course you would want to help them resolve that. So it wasn't a problem.
yeah, yeah. Say a little more about, the classic definition of MI is always it's a client-centered but yet directive approach.
Mhm.
Okay. And clearly, like you're saying, there are ways in which we are nudging them in a more growthful and positive way. Uh,
Mhm.
and like you're saying, Rogers discovered eventually that being purely non-directive, well, you can't even ask a question. You know,
Yeah, yeah.
so we had to compromise there. But maybe elucidate a little bit more that distinction there.
Yeah, that's how we described it in the first two editions, client-centered and directive. And then
Hmm.
we changed it in the third edition from directive, because it sounds too much like you're in control of things as
Hmm.
the counselor. We changed it to directional. There's a clear direction to where we're going. And what is that? That's shared
Hmm.
goals. I mean, the
Hmm.
essence of a working alliance is that
Hmm.
you and the clients agree
Right.
about where you're trying to go,
Right.
and want to move together in that direction. So that's the direction of it. But
Yeah.
it's not like we're coaches with a whistle, that kind of directive,
Right. Right. Yeah.
Rather, we're companions on the journey and helping people get to where they want to go.
Exactly. Yeah. In coaching, we call it co-creating
Yes.
those goals or partnering with our client to, do that. And yeah, and one of the things that I often talk about is what I call a bit of an oxymoron, client-centered directiveness.
Hmm.
Because the reality check is, coaches are being directive all the time. The moment you ask a question, you're being directive. The moment you suggest keeping track of behavior using a tool or an app, You're being directive. But how do you do that in a client-centered way? Instead
Yes.
instead of you need to, that kind of thing.
Yeah, and I think that works. I mean, the direction again is coming from the client.
Right.
It's you're agreeing until the client says, okay, it's not really a goal that you're working toward.
Hmm.
But together you get clarity about where you're trying to go,
Hmm.
and how to get there. And you can do that in a person-centered way.
Yeah, exactly. Yeah, I think it's a great uh, combination, really. And it's funny, I'll just share that when I was early, in developing health and wellness coaching and learning how to be a coach, a lot of my influences were from coactive coaching and Laura Whitworth and Karen Kimsey House and the others. Um, I was finding uh, some of the people at that time talking about MI, and they were this one video in particular. This one fellow was feeling a little threatened by coaching, and so he was kind of saying, "Well, here's MI and here's coaching," and that kind of thing. We've got all this evidence and all these studies, and coaching is just a bunch of people, not doing that well at really delivering this kind of thing, and that's totally changed. It totally changed.
Well, that was never appropriate. I mean,
Yeah, right.
that's
Yeah,
very self-centered. Yeah.
a bit out of the spirit of MI, wouldn't you say?
Indeed, indeed.
Yeah,
Yeah. We have the answer, you've got it wrong. I'm going to tell you what you should do differently. Is it
yeah,
not well received usually?
yeah. Yeah, so it's not there's no competition between the two. There's no two camps. That instead, I think, you know, we've seen how MI folds right into the work of coaches. We've embraced it as part of the really curriculum that needs to be a part of every approved coach training school. You know, um,
I'm happy that we've kept the scientific base, and really that's from Carl Rogers. Uh,
mhm,
he was maintaining you should be measuring what you're doing and testing. And if you have an idea, it's an hypothesis to be tested. So check it, but do it in a way that other people can check it out too. And so we've always tried to do that with motivational interviewing. And we're
mhm,
coming up, I think, on 2,500 controlled clinical trials around the world now, which
mm,
is just astonishing to me and way outside of psychotherapy in so many different fields.
mhm. Yeah, that's something else to talk about. Um, MI's origins and initial work was very clinical. You know,
Yes. Oh,
you
yeah.
you had people that were struggling with addictions and they needed help. And at that time, it tell me, it must have been really radical for you and Stephen Rolnick to come along and say, hey, instead of just, treating these people like they're doing something bad and wrong and terrible for themselves, that they've got to change, and we're going to make them change or persuade them to change. You come in with this totally almost a keto like move of looking
Hmm.
at it from the client or patient's point of view and acknowledging what they're experiencing. I mean, what was that like? How was that received initially?
Yeah, it doesn't sound radical now, thank goodness. And but in the addiction field in particular, which is where I started in the
Yeah.
70s, it was really authoritarian
Oh,
and confrontational.
right,
And sit down, shut up. You don't know anything. I'm going to tell you what's wrong with you and what you need to do.
right.
Well, human beings don't respond well to that in general.
Hmm.
But
Hmm.
that was the norm at the time. And
Absolutely.
and this was coming from a very different direction. And people really recognized it. I mean, it's
Hmm.
become, at least in name, become more mainstream in addiction treatment. Many people say, "Oh yes, we do motivational interviewing." Whether they do or not is a different question. But at least the conversation is different,
Hmm.
and being person centered and listening to people is no longer radical.
Yeah. 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 I mean, even the way you say that, it's almost, it brings up a chuckle because we accept this so much now. We see the effectiveness of it. We know the effectiveness of it. And it's just that respect for another person, no matter what they're experiencing or what they're going through.
Yes.
Yeah.
It's of course, but it wasn't always of course.
Yeah.
We
Well,
had a model that these people are in denial, they're incapable of seeing reality, and you
right.
have to make them see it. Um, Very different approach.
Yeah, I remember, being an undergrad in the late 60s, and a lot of the people working in the drug area were former, addicts themselves and so forth. And they had seen, the misery that it caused.
Mhm.
And it seemed like there was a bit of an edge to a lot of those folks. Like, I've been through hell and I don't want you to have to go through hell, and you're putting yourself through hell. And boy, very judgmental.
Well, it's the way they were trained also
Sure.
in the days of Synanon.
Hmm.
That was a true believer kind of movement.
Right.
There never was good science to it.
Mhm.
And there was almost the idea, if you can make people just feel bad enough, then they'll get better.
Yeah.
Never was any science to that. If you can help people feel accepted as they are, then they can change.
Yeah. Yeah. And so when we have health and wellness coaching clients who are struggling with, you know, everyday habits that are maybe working for their health or working against their health, um, it's maybe maybe it's not as uh, severe or desperate of a situation, or maybe it is. We have ongoing health concerns. We have chronic illnesses that end up taking people's lives and deteriorating their quality of life along the way until they get there. And the whole lifestyle medicine movement has been saying, well, the way that we live our lives, our lifestyle has a huge effect upon the course of an illness. So why can't we work with people's lifestyle and helping them improve that as literally a method of treatment? Yeah.
Of course, yeah. Or maybe treatment is even the wrong framework for it. And
I think
you
so.
know,
Yeah.
coaching's a little safer context in a way.
Right.
I can work and get a little coaching from somebody. That sounds good.
Yeah.
But in both cases, you're a companion helping the person to figure out how they want to go on their journey and where they're headed and if that's what they want to be doing.
Yeah. Yeah. I mean, I love how you're saying the companion, the ally, because that we talk about the coaching alliance and
Yes.
being an ally. That's so important. One of the people that helped with the section in my book, Masterful Health and Wellness Coaching, um, Dr. Um, uh, oh, golly,
I
blown his
understand.
right out of my head right now.
Yep,
Uh,
happens to me all the
Adam,
time.
Adam Archega, I
There
retrieved
you
it
go.
pretty quick there, at Loma Linda University. He had taught a lot of motivational interviewing for years, and he helped review that whole section in my book talking about MI. And he said, we do a lot of the same things, we just call them different names.
Yes, right. Yeah.
Again, one side of the street, the other side of the street, came up with different names, but same street. Yeah.
And also being specific and measuring it.
Yeah.
I mean, I've said many more people think they're doing MI than actually are,
Mhm.
or many more people think they're listening well than actually are. You're familiar with that one too. So I always
Mhm.
want to see it also, and not just talk in the abstract about listening, but actually try it out and demonstrate it and experience it and see what it looks like, because that's a learnable skill too. Rogers made a huge contribution to that, and we know what effective listening looks like.
Yeah, I think Rogers is not given credit for what you're saying about the measurement piece. And I
Indeed.
know Kharkov, Truex, and Berenson, they really were big on developing rating scales for these observable, facilitative conditions. And
Hmm.
I'll never forget one of the most outstanding pieces that they talked about was how they compared different psychotherapy approaches, different theoretical models. and pretty much said it didn't matter what model was being used. What modeled was the degree to which they could provide these conditions. That turned out to be the most critical factor in success.
I think that's right. Terry Moyers and I wrote a book a few years ago called Effective Psychotherapists. And we went back through 70 years of psychotherapy research asking, what is it about therapists who get better outcomes compared to other therapists who seem to be doing the same thing, maybe even using the same manual, literally, and yet how well clients do depends very much on who treated them. What's that about?
Yeah, as you say that, what it brings up for me is I've been training a number of people recently who are working for big disease management companies and insurance companies as coaches. And these companies are trying to leverage huge numbers, of course. And what's starting to happen, or has been happening, is we are seeing coaches work with people just digitally, not even virtually, but asynchronously, where they're just exchanging text messages. I even have a coach now who's working with a company who is, when somebody calls in, they get a different coach every time. So they're not building any kind of alliance, any kind of relationship with the individual coach. And I mean, I understand the crunch of the numbers and that problem, but I don't know how you can really be effective over the long haul unless it's a very simple behavioral change and the person is incredibly ready to go with it. I'm very skeptical of that approach.
It's a testable question.
Yeah.
I'm familiar with what you're talking about. And are you really helping people if they're responding electronically, sending messages, getting messages back from different helpers at different times? Are they really moving in the direction they want to go? And I'm open to the possibility, particularly if you got your staff well trained to be responding like each other in a Rogers-like way. So we could find out the answer to that. I wouldn't assume it's helpful, but I wouldn't assume it's not either.
Well, I'm sure, reaching somebody with something is better than nothing at all, for sure. And as we talk about that, it brings up the whole idea of readiness for change and the work of Prochaska and his associates. And one of the things that anybody that, starts to work with MI and read about it and be trained around it, starts to see this big overlap intersection with MI around readiness for change. Could you speak a little bit about the value of that?
Well, Carlo and I are old friends, so we've been talking about this for a long time. Carlo Di Clemente, but they fit together very well, and we began presenting at the same conferences even back in the 80s. Because in a way, what motivational interviewing was thought to do in the beginning was to help people become ready. In the addiction field, we were blaming people for not getting better, saying, well, come back when you're ready. Well, that's not, we don't do that with cancer, that's not good enough.
Right.
So what can you do if a person doesn't seem to be ready? Well, that's what motivational interviewing was designed to do in the first place. So rather than saying this person's in denial, they're not ready yet, they're unmotivated, we used all that kind of language to get ourselves off the hook and blame people for not getting better. But we can do better than that. And so that was kind of where it started. And the Transtheoretical model and motivational interviewing grew up together in the early 80s.
Yeah, I think the term that was often thrown at people was they're being resistant.
Yeah, that's right.
Resistant patient, the resistant client. And I question, can anybody who really wants to be healthy and well, and deep down everybody does, come on, can they really be resistant? There's so many other things. Yeah.
I think it's the wrong word. We used it in the first two editions. And then Terry Moyer said to us, most of what you guys are describing as resistance is just sustained talk. It's just one half of the person's ambivalence. Nothing strange about that. Nothing abnormal about that. People just kind of want and don't want at the same time. That's perfectly normal. So, well, actually, you're right about that. Is there anything more that therapists mean when they use the word resistance than that? And that's where we come up with the concept of discord, that it signals the client is giving you that we're not dancing together well. You're stepping on my feet. I'm not comfortable right now. And so we disaggregated resistance into those two things, into the client's motivations not to change, which are perfectly normal, and friction in the working alliance, and worked on how to respond to that.
Right. Everybody that learns about MI learns about change talk, but I really think coaches and everybody working with it have to be very aware of, like you're saying, the normalcy of sustained talk. When people want to sustain the same situation, the same behavior, and recognizing that as normal, you start to let go of that judgment, right?
Yes, and you see it as normal. I mean, that's the starting state. Inertia is the starting state. And a body at rest tends to remain at rest unless something gets it moving, and nothing pathological about that.
Right.
So that's where you're starting with sustained talk. How do you get off of that place and help people get unstuck?
Yes, right. So I'm curious, you've got sustained talk, change talk. We want to cheer on the change talk, of course. What do we do when the client says, more things about, well, here's all the reasons that, this isn't going to work. And, I'm doubtful and, skeptical about, making progress. How does the MI person respond to that? Or to what degree do they respond?
Oh, first and foremost, listen and reflect it and let the person know you got it. Because if they don't think you understand it, they'll keep saying it over and over again, So I want the person to know that I hear it, and that's perfectly understandable to me, and there's another side to it, and the client has the other side as well. So what I've often found is when I reflect the resistance that the person is giving me, they respond with change talk. They respond with the other side. If I'm not pushing back against it, which is what we were taught to do in addiction treatment, confront denial, if you don't do that, if you listen well, the person begins to talk themselves into change. Again, I believe people want to be well. People want to move in a good direction naturally, without us having to push.
Yeah. So we might acknowledge how tough something is for somebody.
Absolutely.
We might acknowledge the comfort that they get from that bag of Doritos at 10 o'clock at night.
Sure.
Yeah.
And we developed something called an amplified reflection. We have lots of refinements on Rogers' techniques. And this is responding to what the person's saying and increasing the volume just a little bit on it. So a common one in my field is, I don't have a drinking problem. Now, in the 70s, what you wanted to do is try to persuade the person, like a prosecuting attorney, that they do have a drinking problem. My approach was to say, oh, so alcohol really hasn't caused any problems for you. And the usual response is, well, no. I mean, anybody drinks as much as I do is going to have some trouble with it,
Right.
You must do it with absolutely no cynicism, no sarcasm. Just a genuine, straightforward reflection of what the person's saying with a little more intensity to it. And then the person gives you the other side of their own ambivalence. It's, they say, well, no, I mean, sometimes it's really has been a hassle.
And wouldn't you say that what allows you to say that without the cynicism or sarcasm is because you're operating from that place of unconditional positive regard that Rogers talked about.
Yeah. Right. And I get it. I mean, when you work as long in the addiction field as I have, I know that whole area, that just sounds perfectly familiar to me, so it's not a strange thing to me at all. I get it, but I believe there's a part of the person that doesn't want to stay there, that
Right.
wants to get beyond that. And so I want to hear that person talk also.
Yeah. So now we bring in another intersection, Bandura's work around self-efficacy.
Mhm.
To me, when I hear someone who is so discouraged of making change, someone that in the TTM world we would say they're in contemplation or maybe even pre-contemplation. Usually, it's someone who has tried and failed, and their level of self-efficacy is really low.
Mhm.
So they don't have the confidence that they can make these changes.
Mhm.
And when we realize that that's what's missing here, then I think we can let go of that judgment, let go of that temptation, maybe to say something a little. It has a little bit of that edge to it.
Yeah, it's easy to slip in there, and the very same words have a really different impact if it has just a little bit of a snarky edge on it. I mean, people hear it, and
Mhm.
now it's not a reflection anymore. Now it's a confrontation.
Yeah.
So you don't have any problems with alcohol. No, that's that's going to have a very different response. Yeah.
Uh, yeah, and don't I think all of us in the helping professions, hopefully we've learned, and maybe just learned as a person out there interacting in the world, that everybody has tremendous ability to pick up on that little slight tone of voice, that little tiny way that something creeps in there and makes it, as you called it, snarky. You know,
Mhm.
yeah,
Mhm. We're very sensitive to that.
we
You
are.
you can hear it a mile away.
Yeah. Well, something that I'm going to really encourage our 152 people that are hanging out here together
Oh,
with us
wow.
to
Oh,
do is come up with some Q&A for us. I think we got some stuff already, but I want to move on into some of their questions because I'm
great.
sure some people have been probably chomping at the bit with the opportunity to pick your brain. Okay, so
What do you got?
let me look at some of this here and throw a few to you. Um, let's see. Um, how can you differentiate mindset and heart set? That's a great question.
It, they feel different.
Uh-huh.
I mean, it's the simplest way to say it. Um, yeah, and some of us are much more inclined, to use our heads, and some of us are much more inclined to respond with feeling. That's kind of normal differences. I try to be bilingual in that regard and be listening for and responding to both. But at least to me, it feels different to me when a person's coming from their emotional space or
Mm,
when they're coming from a very cognitive space. I live
mm,
in Albuquerque where we have lots of scientists and physicists and engineers and so forth. We're
mm,
used to dealing with the world very logically.
mhm,
And they come in then for marital help with a partner who's very feeling oriented, and they're trying to think their way through it. So it's two different worlds trying to talk to each other without having common language. So simple answer to me is, I mean, to me, they feel different. That may not be satisfactory, but I'll be reflecting whatever it is that seems to be there to me. A very
mhm,
logical person, I'll be going with that for a while, maybe listening for some underlying feeling.
mm. Okay. Great. So we all need to be more bilingual. That's great. Good way to put it. Another good one here. Has there ever been a time for either of you when seeing a client slash patient that you felt you were reflecting too much? Is there such a thing? Mhm.
Yeah, it comes up. I mean, people ask that in a workshop, and don't clients dislike this? And I really can't remember a client who ever took offense
Mm,
at my reflecting something. How you do it, sure. Add a touch of cynicism. You'll see the person respond and kind of back away from you. So I'm also always watching the person's response to what I'm saying in the moment, because that's immediate feedback of how close I am to what they're saying. But I mean, the old Carl Rogers jokes are doing nothing but reflection.
Yeah.
So your client's suicidal client, they keep reflecting till the person walks up to the window, and so you're thinking about jumping out, yes, and the person jumps out.
Yeah, right.
That's silliness. You
Yeah,
know,
of course, of course.
you wouldn't do
Yeah,
that.
right.
Do you need more than reflection? Yes, you certainly do. But it's pretty hard to hurt somebody with doing reflection well.
Yeah. I loved it when you addressed the conference last year, and you were talking, in the coaching world, we're talking about active listening skills. Please excuse my cough here.
I just got over what you have, so
Yeah,
I appreciate it. Accurate
sorry, but
empathy.
right, that's who you are, man. I tell you, it's great. Um, yeah, one of the things you said was, coaches tend to sometimes get into thinking that they have to just ask one question after another question after another question. And you made the recommendation of giving, I think it was at least two, if not even three, active listening skills for every one question. Kind of more of a ratio like that.
You got to see where the person you're working with is coming from. For some people, getting to one-to-one is a big improvement, just to offer as many reflections as questions. But I like to work with people if you ask a question, then you owe them two reflections.
Hmm.
Because question, you put people in a passive role, first of all.
Right.
It's safer. You feel like I know what I'm doing now. I'm asking questions.
Hmm.
But it doesn't tend to have the momentum of what happens when you really listen to people.
Yeah. And the questions that a good coach is going to form come out of what they are hearing from the client.
Yes.
And I love to say that at the beginning, working with somebody, some of the questions you're asking are for you to be so you understand the person's situation. But there comes this time of shifting to where you become a question composer.
Yes.
Start to think, well, what does this person need to be asking themselves right now?
Hmm.
What kind of question can I come up with that would be great for them to be asking themselves? And that's ideally what you put out there. And when you do that, that's usually productive.
In the conversations that started or thinking about motivational interviewing back in Norway 40 years ago, the people I was working with would say, well, why did you reflect that? Of all the things the client said, how do you know which thing to reflect? Or why did you ask that question? Because you could ask a lot of different questions. Now, my own person-centered training hadn't included what you reflect, we just kind of how to reflect. But
Hmm.
it turns out it makes a big difference what you ask, what you reflect, what
Right,
you affirm, what you put into summaries.
right, right, right. And I think what's very helpful when you're doing a reflection is to not be doing just what we would call a restatement, but
Oh, yes.
to reflect kind of what is the person doing.
Mm.
So instead of saying the words that the client just said, you might say, so right now you're really considering which course to follow.
Mhm.
That's what you're hearing them do. And when the person hears that, they realize, yeah, that is what I'm doing. Let me examine that more. Hmm.
I call it continuing the paragraph. So rather than repeating the sentence you just heard, to say what might be the next sentence in the same paragraph.
Mm.
It's an hypothesis. You're making a guess, and the person will tell you if it's not the right guess.
Hmm.
But it just creates a momentum that's so different from simply repeating what the person just said,
Of
which
course.
easily goes around in a circle.
Yeah. Yeah. And again, I want, from what you're saying there, it's a reassurance to coaches that when we're reflecting, when we're doing this, you can't hardly go wrong. You know, we're not, there isn't that much at risk for everything we say. It's not like we're in a legal battle in front of a court, you know.
Right.
Yeah.
No penalty for missing, I say.
Right.
If your reflection is off, you'll see it immediately.
Yeah. Or if you try something, you and your client just kind of say, well,
That didn't work.
yeah, let's try something else.
Exactly. Yeah.
Right. Yeah, let me look at a couple of questions here. We've got some great ones coming in. When coaching a client whose eating behaviors are influenced by food addiction, would health coaches be adequate support, or would addiction counselors be a better support? That's an interesting question.
I would want to know what each of those two helpers would be doing. It's pretty clear that having a personal history of addiction does not influence your client's treatment outcomes. So if you're personally in recovery from drinking or whatever it is, your clients don't automatically have better or worse outcomes than a counselor who doesn't have that same experience. It's what you're doing that matters. So I couldn't answer that question without knowing what you would be doing if you were trying to help the person. And if you're going to refer them to an addiction counselor, what the addiction counselor would be doing, because it's how you are with people that makes a difference.
Yeah.
If they're an addiction counselor trained in the 70s, they'd be better off not having a counselor like that, chances are. And in our earlier research, we compared counselors trying to do motivational interviewing. And with some of them, the client would have been better off going home with a good book. And with other counselors, it was much better than going home with a good book. That was one of our control conditions. We gave people a self-help book and said, we'll see you in 10 weeks and see how you're doing. So we could compare counselors with self-help. And some were much more effective than self-help, and some were actually much less effective than people working on their own.
Thank you. So from one of our other participants, he's saying, one reason it makes sense seems to be because the change involves real, not imagined risk, especially if you do not yet have a skill set yet to do the thing. I'm not sure that I'm getting somewhere with this question. I'm going to move on to another one here. Okay. Let's see. Okay. Let me find another good one here. Clients often feel deep guilt or shame about their health choices. How can a coach help change a client's self-judgment and foster self-compassion? That's a great question.
Yes. Yet feeling shame doesn't help people change. That was one of Roger's, I think, realizations that when you feel unacceptable, not okay, when you feel bad as a person, it's paralyzing. It actually is more difficult to do something different when you're feeling that way. And for whatever reason, when you experience being accepted as you are right now, it becomes possible to change. Now, it's a strange paradox, isn't it? That when a therapist or a friend or a physician or God or whoever you experience that unconditional acceptance from, now you're freed to change. And Rogers really pointed that out very clearly. I don't know why we're wired that way, but we seem to be.
Yeah.
So trying to make people feel ashamed is not a way to help them get better. And if they come in feeling that way, I think helping to build their self-efficacy or self-worth, however you want to think about it, is important. And again, it's not a matter of installing something they don't have. It's a matter of calling forth what's already there, what's already in them.
Right. I think something that coaches can do is use the active listening skill of acknowledgement more. When I'm listening to recordings, and I listen to hundreds and hundreds of them, I often see missed opportunities.
Oh, yes.
To empathize, or missed opportunities to acknowledge. And most clients tend to be pretty self-critical. pretty hard on themselves and tend to minimize some of the successes that they have.
Mhm.
And a good response by the coach or MI counselor to acknowledge even those little small steps of success, that can make a big, big difference.
Mhm. It's empowering. It's pointing out what they already have and are already doing that moves in the right direction.
Yeah. Yeah. And sharing observations, I think, is another skill that coaches and people working together like this need to get better at. When you notice something that a client is doing, when you notice a pattern, to share that. And what I've often found is that if you just put the observation out there and then let it lay, don't follow it up with a question, please.
Mhm.
Just see the client's response to the observation, and a nice neutral observation without any judgment. How does the client respond to that? Um, it helps increase awareness, which is what all of this is about. And maybe it's something that that person wasn't giving themselves credit for.
There's a real art to how to do that.
Hmm.
It's
Right.
like giving advice, Overall, advice given in the context of counseling is helpful a little bit, but how you do it, it makes all the difference. And you can do it badly and it goes nowhere, and you can do it honoring the person's autonomy with permission,
Hmm.
giving them multiple options, for example, to choose from. It's just much easier to hear the advice when you say it in certain ways.
Okay. Here's not a question, but a comment. I practiced as an occupational therapist for about 20 years before becoming a health and wellness coach. And how I wish I had known about MI all those years. I was treating patients who we labeled as non-compliant.
Yes, yes.
When they didn't follow through with the treatment plan exercise regime that was prescribed to them. Yeah,
They're not, and you write it in the notes, they're non-compliant.
yeah.
I know that one.
Yeah, I think that is something that I think we hear all the time when people finally, and coaching is often a midlife career shift that people make.
Mhm.
And they're sometimes saying, the same sort of thing here. Geez, I wish I had known this when I was a nurse. I wish I had known this
Yes.
when I was, ah,
Mhm.
geez. And fortunately, one of the things I have observed is that the medical world, and I think it's because there was a lot of MI training that was done that was pretty short, pretty easy for people to at least have some exposure to. I think more people in the medical field started to pick it up. You know,
Yeah, it's happened. Yeah.
Mm,
Mhm. It started to humanize some of these service professions.
right. And I think as a result, they got more information, from their patients
Mhm.
than when they were, having that authoritarian approach.
And that's a good thing, I think, about learning a person-centered approach. When you shift into listening to your patients rather than giving a lot of advice in the beginning, they respond differently right away. So it feels like you're working with different kind of people than you used to see.
Hmm. Okay, another one here. Um, Here's another question about different fields. To sit for the National Board for Health and Wellness Coaching exam, one has to have participated in an accredited program that is recognized by the NBHWC. Tell us your thoughts on coaches versus someone who has studied psychology, etc. I am so glad to be a part of this movement to help with others. Well, as somebody who has, a PhD and was a licensed psychologist for many years, who then learned how to do coaching and realized I had to learn how to do coaching,
Mhm.
and went through, coach training. Um, I will comment that it is partly a different mindset And that mindset may be due to the nature of your psychology training. I think, you and I were very fortunate to have this Rogerian background, a lot of our training, even though there was also a heavy dose of behavioral psychology and everything like that. But, I think that someone who has studied psychology still doesn't have the coach approach and the way of working with somebody, or somebody even who is trained in MI. You don't necessarily have that. You understand behavior change, you understand behavior theory, but usually you're trained in a remedial type of approach. You're not trained in a growth approach. Wouldn't you say that's true?
Yeah, well, you're trained to look for what's wrong,
Right.
to find pathology. So it's like medicine in a way, and then to fix that.
Mhm.
That's a very different way of being than a coach approach, but you can do the same thing with a coach approach. As a psychologist, you can have that knowledge of the things that go wrong and be aware of that,
Yeah.
but still taking a person-centered approach.
Yeah.
I will say in our own training research, we have found no relationship between years of education, at least years of post-high school education, and the ability to learn motivational interviewing, the ability to learn a coach approach.
Mhm.
People can get it,
Yeah.
even PhDs can get it. So it's not related to how much additional education you've had.
Right.
It's just a learning a different way of being with people.
So again, we're back to the how to be
Yes.
carrying the day, you
Yeah.
know. And one of the things that we recognized early on with the national board when we were, setting up standards and everything else was that people come from a diverse background to coaching, and they can be extraordinarily effective as coaches, with clinical backgrounds, with educational backgrounds. We've
Yes.
had terrific coaches coming out of business backgrounds and so forth.
Mhm.
It's really, like you've said a number of times in this interview here, um, how learnable these skills are for everybody, and
Yes. Mhm.
how you do have to practice, you do have to listen to recordings, you do have to have mentorship, um, and develop both who you are and what you do. You know,
And how much do you have to unlearn? I guess is another point. I
yeah,
mean, the more years of education you've had, the more habits you may have developed that you need to let go or modify a bit to take this kind of approach with the people you're trying to help.
exactly. Yeah, yeah. So I really want to thank you, Bill.